Hi, my name's Mark. I'm an A&E nurse working in central London. So I've just come back from annual leave and done my first shift back in the hospital, now dealing with the coronavirus crisis. It is really stressful. We're having to practice a lot more stringent infection control than we ever have before. We've converted half of our majors A&E into just dealing with respiratory diseases to illnesses to cope with all the patients coming in, and also having to split sort of people we think are non-infectious from the potential suspected coronavirus patients. We're having loads of problems. We were 5 nurses down on our shift. A lot of agency nurses are cancelling their shifts because they're not being guaranteed sick pay if they contract the virus or have to develop symptoms and have to self-isolate. None of us feel confident in the level of the PPE we are assigned. That we don't believe the guidance provided from NHS England is accurate on the risks, and that what we're wearing will protect us. We have a lot of colleagues from Spain and Italy, and they're hearing from on the ground how bad it is in their countries, and they are trying to sound the alarm here, and they're anxious that the government isn't doing enough, that our NHS managers aren't doing enough. NHS England announced they'd be testing they wanted trusts to start testing their staff on March 17th, and we still haven't got that announced. For no plan for doing that yet in our trust, so we're having to send lots of staff home as soon as they develop symptoms, so we have even less staff. My hospital is an infectious disease centre, but we have lots of side rooms. We're set up for infectious diseases, and we're already running out of space, running out of side rooms to isolate patients, and we don't have enough facilities. And this is just the start. We're going to potentially see a huge surge in infections in the coming days and weeks, and I really fear we're going to be overwhelmed. So we need the government needs to do a massive amount more. It needs to ensure all hospitals have adequate PPE and review the guidance so that we feel properly protected, and we have the right level of masks and gowns to stop us coming down with the contracting the virus. We need a massive expansion in the health system, many more ICU beds. I know they're in the process of doing this, but it needs to get much faster, and many more. I mean, they get a requisition 8,000 beds from the private sector, but they need many more than that. They need to expand the level of testing massively, and test in the community, and find out the true scale of this. And actually, they really need to lock everything down and provide financial support for all those people who are self-employed or on 0 hours contracts, who are otherwise going to be forced to go to work by their employers, or because they need money to pay their rent. There needs to be financial support for everyone, so everyone can stay home, stay healthy, and not contract the virus. That's what we need if we're going to get through this. I fear the NHS is going to be overwhelmed, and we are going to be where it clears now, on the verge of collapse within a few weeks. So please stay home. Lobby the government, write petitions, write to your MPs, do whatever you can, but stay home and stay safe with your loved ones.